Sandeep. How are you? Can you hear me?
Hi, Vicky. Good evening. I can hear you. Thank you. Thank you for
Good evening.
inviting me.
Sure. Thank you so much for joining in the podcast. And just for the listeners, I just want to mention that Sandeep is the CEO and founder of an organization called HEALTHCAA. That is his own project. It's a healthcare omni-channel approach that he has started. And he's going to talk a bit about HEALTHCAA. He'll talk about his why he started the organization, how why he connects with the idea, what is his purpose, and definitely then we will tune into certain nuances of the power of voice, the power of communication, and whatever that he feels like sharing his life journey and his personal journey and his professional journey. Thank you so much, Sandeep, for joining in. The mic is yours, the stage is yours.
Thank you. Thank you, Vicky. First of all, I want to say a beautiful initiative, Vicky, and I really appreciate that you're establishing communication about various topics. And I'm glad that you invited me to talk about healthcare, about the initiative that I've taken by the name of HealthCare. So thank you for the platform that would help me to talk more about healthcare management. So I always appreciate when people do that. Thank you.
Thank you so much, Sandeep.
Having said that, my name is Sandeep, and a very good evening to all the listeners, or good morning wherever you are. I couldn't have been more happier. I'm getting an opportunity to engage with all of you. So thank you for that. So a bit about me, Vicky. I am the
Mhm.
founder of HealthCAA. HealthCAA is basically a healthcare management system project.
Mhm.
And as you rightly said, we are trying to, introduce an omni-channel approach for healthcare seekers.
Mhm.
Um, there are a lot of gaps for healthcare seekers when they're trying to receive healthcare services from various providers. So we are trying to, build a platform. We are trying to build an ecosystem through which healthcare seekers can get access to all the essential healthcare services at ease. So that's the goal of our project, and I'll be happy to answer your questions. If you have any, I'll be happy to talk about it. Thank you.
Sure, sure.
So where do we get started from? Do you want me to get started by telling you how the idea came into existence, or you want me to talk about the challenges or the whys? How do you want to go about it?
So I want you to talk a bit about your journey of your life, your qualifications, your journey as a corporate person, as a personal person, reflections on the life journey, and how you reach to the stage where you got that why or that idea to create healthcare. That would be interesting because I'm seeing the whole conversation that we're doing as a timeline. So we're going through the timeline, and whenever you feel like pitching a bit about your journey, that would be interesting.
Yeah, so this project is very personal to me, and there
Mhm.
is a story involved. Obviously, you cannot come
Sure.
up with a solution if you haven't witnessed the problem, or if you haven't gone through certain problems in your personal life. And there is a saying, if you have gone through a problem, you would be possibly having one of the best solutions available for not only you, but for everyone at large. So there is a history to this project as well. So, um, okay, so in 2007, my sister passed away due to leukemia. She had blood cancer,
Oh, okay.
and I, at a very early age in my life, I used to visit hospitals every now and
Oh,
then,
so
and that's
sorry.
when
So
I.
sorry to hear about that. I'm so sorry.
Thank you. At a very early age, at a very impressionable age, I witnessed a lot of challenges that I was able to personally witness
Mhm.
when I was visiting various hospitals for the treatment of my sister, and running around for various healthcare services during that age. I felt that most people, because I was seeing a lot of people in the hospitals, so I felt that most of the people do not even have an agenda for healthcare. They
Mhm.
just reach out to hospitals at the last hour.
Mhm.
And apart from that, not only from hospital point of view, but personally from patient perspective, people didn't had any healthcare management plans for themselves. And obviously healthcare infrastructure, the lack of resources there, the random way of working in public healthcare sector, I was able to witness a lot of gaps there. And that's when, I realized that I need to do something about it. And that's when I started thinking about it. I didn't have anything to do with healthcare industry. I come from a different background.
Mhm.
But because I went through these problems, I really wanted to do something about it. And my one thought that's got stuck with me, that obviously there is it's evident, like there is a scarcity of the resources in the healthcare industry. Apart from that, there are infrastructure issues. That's not even, that doesn't even require a lot of analysis or data uh, in order to identify that. Any random person in India knows that how poor our healthcare infrastructure
Mm.
is. But from patients' perspective, there is a fault as well. uh, Healthcare is not like, nobody's planning their healthcare. Nobody's thinking about having a management plan with their healthcare.
Mhm.
So that got stuck in my head, and I really wanted to address this, and that's how I started my journey to come up with this project, talking about what we are trying to achieve with this project. So basically, like every entrepreneur, they got a vision for their company. Similarly, I do have as well. So we are trying to become the first point of contact for healthcare needs of people of all socioeconomic strata across India. That's
Mhm.
our vision. So if you closely see the brand name itself, the meaning or the vision of the company is within the brand name. So the brand name that we go by is HEALTHCAA. That's Health, CAA.
Mhm.
CAA stands for convenience, affordability, and accessibility.
Beautiful.
These three are the most crucial thing for a healthcare seeker when they are trying to reach to a healthcare provider.
Mhm.
So that's the vision that we have. And then also, how we are approaching this, we are trying to bridge the gap between patient and the treatment by making healthcare affordable and accessible for one and all through the ecosystem that we are developing. So that's a bit about my project, and that's the background story of the project. Obviously, it's a long story, but just for the interest of saving time, I really would rather focus on talking about the project rather than the story at length.
Mm. 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 And I very strongly feel that when you're mentioning these three major values, convenience, affordability, and accessibility, I think these are the things that you could not, you felt there was a void in the system when you went into the healthcare space, and when you went into that zone where you have to be into that healthcare ecosystem and you can see the functioning there. These were the major three things that you felt that there was a void, there was a lack. And that's why you have created them as part of your purpose, as a part of your need, as a part of your value.
Absolutely. The medical practitioner that we have in India are
Mhm.
one of the best ones out there across globe. So obviously, skill set is not a challenge for us. We
Mhm.
have like great healthcare service providers out there. But again, as I talked about, as I spoke about, the public healthcare structure infrastructure, that's very poor. Obviously, the kind of budget that we have
Yeah.
assigned to our public healthcare institution is on a lower side. Even if we go by the global standards, we fall in the category where we can say that our healthcare budget is on a lower side.
Mhm.
But on the contrary, we do have great private medical institution, but those are very unaffordable. A regular person would have to actually, spend entire lifetime saving in order to receive treatment for some of the treatments.
Mhm.
So that's why affordability is crucial. Then convenience, because a healthcare seeker needs convenience because he's already suffering.
Mm.
He's going through the illness, and you need bit of convenience when you are trying to provide services to one who's ill.
Mhm.
So convenience is another aspect. Why I have this as a objective to provide convenience, because it's not convenient right now. And I'll tell a bit about that in uh, more descriptive way as we proceed with the conversation. But
Sure.
convenience is a crucial aspect, and accessibility, because in tier 1 cities you still have like big medical institutions to go to, but if you go to tier 2 cities, there are a lot of
Mm,
treatments that are not available and is not
exactly.
handy to the healthcare seeker.
Mhm. I think these 3 points when you're mentioning, just an image flashed in front of me. We are all in that state of COVID. The pandemic, the third wave is about to approach, and we know that during the time when there was this dearth of oxygen cylinders, I think these three statements, these three values, when you're mentioning, they sum up the whole issue wonderfully well. There was no convenience for the people with regard to the accessibility of those cylinders. There was no affordability because people were charging a lot of, they were upselling it, and they were like inflated rates they were selling it. And then definitely the concept of availability of the resources. So I think this is something what I can correlate with what you're
Absolutely,
saying.
and I'm glad that you brought that up, because that is what exactly we're trying to address here. There is a lack of transparency,
Mhm.
and we are aware of that. And a healthcare seeker have every right to know all the aspects of the services that they are receiving, and they need to be informed about everything. That's a basic right of every healthcare seeker if you go by the law as well. But
Mhm.
unfortunately, the practices that we have in place, it keeps it opaque for the healthcare seekers. Though law says that healthcare seekers should be aware what they are paying, what for what they are paying, they should be aware of all those things. But unfortunately, we saw a lot of things that shouldn't have happened during the COVID second wave, as you rightly mentioned about unfair pricing for the oxygen cylinders, then availability of beds for the patients.
VIPs, VVIPs.
There was a discrimination, yes.
Yeah, yeah. And
Absolutely.
also the healthcare budget. Like I think in the starting you mentioned that the healthcare budget from the government is not of that order where we can like
See,
create the
I don't
Mhm,
blame government for
mhm,
these things. I
mhm,
absolutely do not, because I think it's people at large who need to be aware of what they
mhm,
should be prioritizing for themselves. Like, we are in a democratic setup, so government will only pay focus or give attention to those things what people are asking for. So unfortunately, healthcare is still not an electoral issue. And if it is not an electoral issue, obviously your leaders wouldn't be paying much attention towards that, because uh, they would give priority to the promises that they have made to the people at large while contesting their elections. So if healthcare becomes an electoral issue, I'm hoping things will get better.
that's great. That's great. So I feel that what we're trying to say is that the awareness is still like it is still not at large, and people have to become more aware because people talk about the insurance plans, people talk about their health plans and all, but they never talk about their healthcare insurance or their healthcare plans or their. I think there was this one thing which you mentioned, which is what you call the wellness package. What is that called? One particular word you
Okay,
mentioned.
so we have like three verticals that we are catering to, which I'll
Hmm.
be talking about that at later stage. But the three verticals that we are trying to provide services through are like for your physical well-being,
Hmm.
as in medical services. The
Hmm.
second is wellness care, which
Hmm.
includes your mental health and dental
Hmm.
care. Then other methods of
The oral hygienes and all.
yeah, oral hygiene. Then apart from that, other methods of uh, healing your body. So there are several other methods like ayurveda, then you have
Ah,
homeopathy, and
that is
several other kind of treatments that are available as an alternate treatment. So we are addressing that as well, because we believe that you know all methods, if it doesn't work for every illness, it might work as a preventative healthcare aspect.
Mm.
From that perspective, it might be helpful for people, and there is an evidence available that Ayurveda does work, yoga does work on people from preventative aspect. The third thing is, like, we are calling it as a miscellaneous service, where we are talking about blood donation, ambulance services. So we have these three verticals that we are trying to provide services for. Uh, but we'll talk about that later. Uh,
Sure.
you know, uh, the journey of the entire project begins with whys, as you
Mhm.
would
Mhm.
be knowing that most of the entrepreneur, when they are planning their project or when they're trying to build their business, they need to know about the problems that they're trying to come up with a solution for. So, Vicky, we also did the same thing. We were able to identify the problems that we want to tackle, and if you want to know about it, I'll be happy to share that. uh,
Sure, sure. Please,
okay.
please.
So, we realize that, currently the healthcare services are scattered both online and offline,
Mm-hmm.
and this needs to be addressed because it results in a lot of inconvenience for our healthcare seekers, as they have to run around from one place to another, physically carrying all the health records, and then running to a diagnostic center sometimes, then going to a hospital, then separately going for buying a health insurance. So all these things are scattered, and it causes a lot of inconvenience for the healthcare seeker. So from convenience for convenience, we really want to address this challenge. Apart from that, as I stated, that accessibility is a major challenge for a lot of people. So in tier 1 cities, you have big medical institutions to go to, but in tier 2 cities, or even in tier 1 cities, at some locations, it's very difficult to get accessibility to right kind of medical services. So we want to address that challenge as well. And there are two aspects when you're a healthcare seeker. You are considering about two things. Obviously, one is the accessibility, just I just spoke about, and the other is the financial management, affordability. That plays a crucial role as well. I mean, if you know that you have to go to a hospital, and you will end up spending, may say, 20,000 rupees. For you, it might not be a problem, but for a lot of people, it is a problem, and that's why they ignore going to hospitals for consulting to a doctor, in fear of the kind of money that they have to spend. So that challenge has to be addressed. Apart from that, what we found, um, and because I've witnessed all these things very closely, a lot of people do not maintain their health record. And what I mean by that, health records, why somebody has to maintain health records? Well, it is very crucial for a doctor to provide accurate treatment to the patient.
Mm-hmm.
So what we were able to witness is that a lot of people, I mean, if I'm not making this sound very big, I'm assuming it's over 95% of the population is not maintaining their health records. They do
Mm.
not have any medical papers handy when doctors ask them about their medical history.
Beautiful.
Apart from that, we have witnessed penetration of mobile technology at a very large scale in last decade. But unfortunately, we are not leveraging this technology revolution in order to provide healthcare services to masses. We can do a lot with technology, but we are not leveraging that. So this one challenge that we want to address. This is the other one that we want to address. And apart from that, uh, there is very less focus on preventative healthcare. Now, what I mean by that, you will be surprised to know, Vicky, 80% of the critical illness can be cured before it occurs through preventive health checkup. So a simple full body checkup
Mm-hmm.
can give you an advantage of uh, identifying a critical illness at an early stage.
Mm-hmm.
And if you're able to diagnose a disease at an early stage, you can treat that. But if you are not aware that I'm going through something, because I'm not going through a preventive health checkup, so how would I know about it? I know that my body's feeling restless. There is something that is happening within my body and I'm not comfortable with it, but I'm not going to get myself checked for a preventive health checkup. How would I know what I'm suffering from?
Mhm.
And at a later stage, the suffering becomes critical, and that's when it becomes sort of like difficult or impossible to manage at a later stage. So just we want to address this preventive healthcare challenge because there is not a lot of focus on that. So these are the challenges that we are trying to address through our project.
And it's very interesting when you're mentioning about this thing that people are not even trying to put that effort into getting that awareness how uh, preventive healthcare checkup can be beneficial for them, because it will make them aware about maybe something becoming severe in the near future, and it will help them to diagnose the issue just before it becomes something like a big problem.
Absolutely, you got it. That's the thing. I mean, if people pay, I mean, I don't know uh, if people will be able to pay entire attention to the healthcare management. We are trying to do our bit, but again, at the end of the day, it depends on the people, right? If they would be taking this into cognizance, definitely they will be able to tackle a lot of unnecessary challenges that come their own way. uh, there is a remedy available to a lot of problems if people are, you know, practicing healthcare management. But simply by opting for preventive health checkup, they would be able to, you know, eliminate
Mhm.
uh, 80% of the critical illness. That's a huge number.
Mhm.
You just imagine how many diseases people can avoid before it occurs if they are just simply going for a preventive health checkup.
Mhm.
Unfortunately, a lot of people are not doing that, and it's affordable, by the way. And we're trying to make it more affordable, but it is still affordable.
I remember, Sandeep, you were mentioning something about a community network.
Yeah,
And
those things are like the part of the project. I'm
Mhm.
talking about the the community network is basically for, obviously, from accessibility and affordability
Mhm.
perspective, we have come up with the solution where we are trying to build a community so that community can come together and say, if I'm going through a disease where my
Mhm.
medical institution is saying that, you know, the expenditure would be, say, 40 lakh rupees. Okay, I don't have that kind of money on me. So what should I do? Should I give up? No, obviously not. Money is secondary in front of healthcare, right? So we are trying to have a community system where people can come together and support each other, be it like for providing organ donation
Mhm.
or doing the blood donation or financial support. So a community plays a crucial role for
It's
receiving.
like a teamwork, like a coordination between one commune network.
Exactly. I mean, uh, the concept of family, it works like a
Mhm.
concept of family. So if I know one of my sibling is going through some problem, uh, my sibling should be aware that I'm there, having her back or his back, right? So similarly in community that we're trying to build, we are just going with this particular principle, the family, the principles of family that we have. So with keeping that goal in mind, we want to build a community
That's
specifically for
great.
healthcare services.
That's great. That's interesting, because in this, not only the people get a psychological benefit, but they also get a kind of financial benefit as well, because the community is at large, they will be providing, and if everyone can give in certain amount of value, certain amount of finances, then together it becomes a huge amount. It's almost like crowdfunding, but here the crowd is someone which is a family. It's family funding,
You
basically
nailed it. The
network
term
funding.
that you used, you nailed it. It's a crowdfunding, basically,
Yeah,
but specifically for healthcare expenses.
for healthcare.
And not only crowdfunding, but obviously there are other aspects as well. Like, you know, say somebody is in need of blood.
Mhm.
Okay, they need blood donation for their treatment. Obviously, blood cannot be bought with money. It has to come through people.
Mhm.
And the kind of lifestyle that we have now, we are not that social any longer. I mean, we are
Mhm.
social, but uh, when it comes to healthcare, we do not get together that often nowadays.
Mhm. Mhm.
So and it's something that everyone needs at the end of the day. So if I'm going through certain requirement for blood, it has to come from people, right? So how do we address this challenge when I don't have access to so many people in my surrounding, because I'm too busy in my work, my lifestyle is such that I'm not able to take out time to build my social relationships. So how do I do that? So we are giving you an ecosystem where you can be a part of the community. Everyone will be coming there together, keeping the healthcare aspect in mind. And with this community, you would be able to not only ask for funds if you are in need for your healthcare services, but you can also ask for, blood donation for your treatment, or plasma donation for that matter, or maybe organ donation if your case required some sort of an organ donor. You will be part of this community, and you can seek help from community, and vice versa. All the members who would be part of the community, they will be the giver and the taker at the same time.
Well, that's very interesting. So I can feel that this large network will be having a lot of large volunteer base as well. People,
the services has to be mostly volunteer, like especially when you're indulging yourself in a concept like of healthcare community, as in community participation is mostly service oriented.
Yeah, I can understand.
But as a company, what we are doing is we are to encourage services from people. We are incentivizing the participants. So say if you are the one who proactively go out and help somebody in the community, we will help you points, and those points can be redeemed in various ways in your hour of need.
Wow, that's brilliant. It's almost like you become a part of a game, and at the end, it is not just a virtual game, it's basically a real game where you are helping someone, you're providing the value to the people, you're creating the impact.
Yes.
Someone, and it's a game of life and death, and the community as well.
That's funny that you said that, life and death. Yeah, to an extent, yes. But again, I want to say that whenever you are providing your services, you deserve to be rewarded. So our way of rewarding is basically to help you have a priority in your hour of need when you're extending your support to the community members.
I think the best thing about this is that when you medal someone, give a medal to someone, you also make them aware that whatever the thing that they created, whatever thing that they did, it created a huge impact. Till the time we don't give them that empowerment, the self-empowerment, the self-awareness, extremely important, so that they can keep on building that network further. It's almost like everyone is getting connected together, and that chain keeps on building together.
Absolutely. Apart from recognition, you will be also incentivized that can be utilized for your healthcare services in future.
Wow, this is sounding very interesting, and I'm looking forward to become a part of it and give my values into the network.
Absolutely. It's a mass-based project. Without participation, this kind of model wouldn't work. So we are targeting masses, and this is the project for masses, by the masses, for the masses. It's a very democratic approach. It's a very democratic approach for healthcare management. So it's not a typical company that is aiming to, generate revenue per se, just to have further growth as a business, but the intent of the project is to serve.
To serve, yeah, and also to provide them those opportunities that somehow you were not able to grasp or you were not able to grab. So you're building that channel which people can access in such a manner that they can have a smooth journey through whatever the financial mishap or any kind of adversities that they're facing through this journey of healthcare service person.
Absolutely. And in fact, I wanted to tell you about the project itself, because, we have spoken about the whys, we have spoken about the background story of where the project came into existence from. We have spoken about all those things, but what exactly we are trying to build, I'll briefly talk about it so that people will be able to, the listeners that we have, beautiful listeners who are listening to us so patiently, they will be able to identify what exactly we are trying to build. And they will have more clarity about it. So, we identified there are 13 essential healthcare services that everybody should have access to. And these essential healthcare services should not be scattered for them. So the whole idea of building this HCMS project, HCMS is again healthcare management system. We have, we are trying to build an ecosystem while leveraging the technology and obviously in real-time assistance as well. We are trying to build an ecosystem both online and offline to give access to all these essential 13 services to all the healthcare seekers. This includes, from financial management point of view, we are building a HEALTHCAA wallet. A HEALTHCAA wallet will help you, most of the people, they don't do savings for healthcare planning. Okay, they don't make a budget for their healthcare requirements. So we are giving you a wallet space where you can plan your healthcare expenditure and you can save money for your healthcare expenditure. Second is we are giving health insurance on at real prices. So there are a lot of commissions attached. When somebody is buying a health insurance from market, people end up spending money for others' commission when they are buying health insurance. So we are eliminating those commissions and we are giving the insurance at real price to the customer or the healthcare seeker.
Okay.
These two things are from healthcare, and third thing is HEALTHCAA community, where people can come together and participate in a discussion about various healthcare topics. They can do the crowdfunding, they can seek or offer various helps like organ donation, blood donation, plasma donation, and all those kind of thing. And from financial management aspect, they can donate money for some cases if somebody is in a requirement of it. And similarly, they can seek at the same time if they are in requirement. So these are three services that we are trying to offer through our platform from financial management aspect, because it plays a crucial role. Financial aspect plays a crucial role for a healthcare seeker. So these services will be provided through our ecosystem. The other services that we are trying to give access to our healthcare seekers is HEALTHCAA Consultation. We are going by the title HEALTHCAA Consultation. HEALTHCAA Consultation is basically applicable both online and in offline setup. So online health consultation would be given to all the healthcare seekers via video call, audio call, and textual chat. Okay, there are a lot of problems. There are a lot of illnesses where people do not want to, they feel uncomfortable going to make a visit in person to the consultant. So they can talk about their problems through a text chat. Say if somebody's going through a mental health issue, and if they're not comfortable visiting somebody in person and they want to either talk to a consultant over a phone call or maybe via chat with an expert, they can do that. So we are providing that through our online consultation services. Apart from that, in real time, if somebody wants to visit our partner doctors in person, they can visit our doctors in person after taking appointment through our platform, and they will be given discount on the consultation fee. So whatever money they possibly can save, we'll try to extend that support. So apart from that, we are focusing on providing a preventive health checkup. So there is a package that we have built within the subscription plan that we are planning to come up with in the years to come. So they will be going through annually full body checkup, which will help them be aware of their physical health. Apart from that, we will have HEALTHCAA telephony services. HEALTHCAA telephony services are for those who are not like tech savvy, who do not know much about how to use a smartphone, or they do not know how to go on a computer to seek services. So HealthCA telephone is basically our bunch of team members would be always available to assist the healthcare seekers about how they can access the services that we are offering them. So they will become their so our team will become the representative of the healthcare seekers to get them access to all the essential services. Apart from that, we have Diagnostic Assistance. So we have partnered with several diagnostic partners. These diagnostic partners will obviously help you with diagnostic tests. Apart from that, you will be able to get discounted price so that you can save more money. So the whole idea is to give the real prices, because there is a lack of transparency in healthcare services at the moment, and we are trying to eliminate that. So whatever these services that we are talking about will be at the real prices. There will be no commissions to give. It will be purely on the, we are eliminating all the profits that possibly healthcare service providers make. We are eliminating that, and we are trying to put that back into the pocket of the healthcare seeker. The next one that we have is drug delivery. Drug delivery is basically we are aiming to partner with our drug partners. There are various drug partners that we have, and these partners will not only provide you discounted price on the medicines, but they will also ensure that drug is getting delivered at your convenience, at your doorstep, if you want to avail that. So doorstep drug delivery options will be provided to you, and it will be done at a very fast pace. So I don't know if it is okay to talk about the model that we are going with, but that will be too lengthy. So let's not go about how we are aiming to do that. But we will be able to do that at a very fast pace. So you do not have to wait for days in order to receive drug at your doorstep. We have a model in place through which you will be able to have access to the medicines, essential medicines that you need at a very fast pace. But again, this is only applicable for tier 1 and 2 or tier 2 cities, because in rural area, we still haven't figured out what should be the right model to get the drug delivered at the doorstep. I'm sorry for the dog's bark at the background. I apologize.
No problem. Do you feel drone, like when you were mentioning door delivery, can we also think about drone delivery?
I mean, that's at a later stage, but the kind of cities infrastructure that we have, there are a lot of complications in that model, but yes, definitely worth considering, and down the line we may consider that.
Wow. So that's very interesting and very exhaustive, very comprehensive.
Last two services that we are left with, I will quickly wrap this up. So the next one that we have is, just allow me a moment if you can.
Sure, no problem.
I can't help it. I mean, I can't control dogs.
No
Sorry
problem.
about that.
Our dog is also a listener. Don't worry about it.
All right. So the other thing that we were talking about is, people do not maintain their medical history. So we realize why people are not able to do that. Physical and bulky copy of health records are very difficult to maintain for people. Some people who are who have sense of awareness that why medical history is important, they keep it. They keep the physical copy of health records for some time, but after certain years they end up losing those crucial records. Because
even they don't have that awareness that this will be something which will be extremely relevant for them.
Even those who have awareness, they find it difficult to maintain it, because physical copies are always difficult to maintain. So we are providing this digital platform where they can digitally store all the medical records,
like a cloud.
So all these services will be, from technology point, will be provided on the cloud.
Wow, that's interesting. So, I'm hearing a lot of things with regard to your omni-channel, and I've become aware about how you will be like proliferating and diversifying your approaches. And I was just trying to become like a patient, and I was just traveling through that journey. And it eases out because everything is there. There's a network. there's a channel, there's an awareness, there's an availability, there's affordability, and the various ways in which these amenities will be provided to me in the right manner, the right time, with the right prices. So everything that you have covered, Sandeep, hats off to you and your organization
And in fact,
and the
one
team.
last point is health
Sure,
forum.
sure,
I want to talk about that as well. So we are
sure,
also,
sure.
because we understand the kind of limited earning that people have in India.
Mm-hmm,
So,
mm-hmm,
for a general healthcare inquiry, if you visit to a a physician or a consultant, you will end up giving something to him, right?
mm-hmm,
uh, and we want to help healthcare seekers as much as possibly they can financially save. So
mm-hmm.
we will be also providing a health forum. Health forum is basically if you have a general health care related question. Say you want to know why diabetes happens, is it a
Mm-hmm,
critical illness or not, can it be treated? These are very general questions to ask, right?
mm-hmm, mm-hmm.
So we'll be giving you this forum via the technology, where all the participants or the members of the healthcare community can ask questions on a forum,
Mm.
and our doctors would be happy to voluntarily answer those questions for them, and you don't have to pay for those
Oh, wow.
inquiries that you're making. So all these services would be provided to the healthcare seekers or the members, both in online and offline setup.
Wow.
And from technology point of view, these services would be accessible for healthcare seekers from both mobile app and web portal. So
That
that's the project that we are building. It's a complex project, very complex project. There are compliances that we have to take into consideration. Then we have to ensure that whenever our users are availing these services, it has to be seamless for them. So
mhm.
it is a complex project, and bringing so many services together at one place, not an easy task, but somebody has to do it. So
Mm.
here we are trying to do that.
And I'm glad that you are the one who is doing this, and I'm glad that you're talking about these things, and people are becoming aware about this, and they will get connected with you soon. So more power to you and your vision and your team. And this approach is beautiful. I love it. Being
Thank you,
just
Vicky.
to think about the journey of a patient, all these things available in your vicinity, in your proximity, and definitely cost factor is a very big factor for the Indian population. We
What
are
I'm
all
liking
living.
about
Yeah.
this conversation, I'm sorry, I interrupted
Sure,
in
sure.
between.
Please go
What
on.
I'm liking about this conversation, this is not a typical business conversation that we are trying to have. It's a very human.
Yeah,
I mean, I can sense there is a sense of how do I put it across? Uh, there is touch of humanity in the
yeah,
discussion. We are
definitely.
talking about what up, because the entire goal of this project is to keep the healthcare seeker at the
Hmm.
center.
Hmm.
They will be the pivot. Everything is being built around them so that they can have the convenience and uh, accessibility to all the essential
Hmm.
services. So I'm glad that we are having this beautiful discussion, and thank you for doing this. And this means a lot. And thank you for giving me the opportunity to, you know, come across, to talk about this project at length for your audience. Thank you.
Sure. Thank you so much, and I'm glad that you have started something on these lines.
And
Uh,
again, I
yeah.
wanted to tell that because communication plays an important role for me.
Hmm. Hmm.
Uh, and I know that you're a voice coach, you're
Hmm.
expert in your field, and I because I have to talk about this project to a lot of people every now and then. So I'm sometimes visiting investors, sometimes I'm going to the vendors, sometimes I have to
Hmm.
speak to the people who are directly or indirectly associated with our project. So communication plays an important role, and I'm glad that I'm doing this podcast with a voice coach. So thank you for the opportunity to allow me to communicate about the project that I'm doing.
Sure. Thank you so much. And I'm glad that you have this vision and you're going forward on this vision. because there are very few people I've met who have a certain vision and they're going forward with that vision, because they always say that these are the obstacles that they are facing. This is something that is not possible, and you are making everything possible that is under your power. And the best thing that I liked about this whole concept was that, Sandeep, because you went through that experience and you understood that aspect of empathy. So this whole project is nothing but a concoction of experience and empathy and the willpower. And the way you are connecting everything together with affordability, with convenience, with capability, all those things, it's beautiful. It's beautiful, wonderful.
You
So
nailed
I'm
it. When
really.
you said empathy is at the center of, you nailed it. I mean, because you're a communication coach, so the way you would be able to put it across, I wouldn't be able to match you ever. I know that,
Oh
but
no, please.
but there, yeah, it's a very empathetic approach that we have
Mhm,
taken while building this project. And as I stated, the vision of the company is also very service oriented,
mhm,
because uh, I believe few things cannot be accomplished without keeping the intention of serving people. So if you're in healthcare industry, your intention should be to serve. If you're a soldier, your intention should be to serve the nation. If you're an educationist, your intention should be to serve to, to to the children who are trying to seek education through you. So these things are very crucial. Service should be the intention.
mhm,
Unfortunately, what we witnessed in past few decades, uh, too much of commercialization. Obviously, I'm not against making money. Obviously, nobody is. Who hates the money? Nobody
mhm,
hates money.
mhm.
But again, I believe money should happen to you. Money should come to you through your services.
Mhm.
It should not be your primary goal. It should come to you
Beautiful.
as a reward.
Should be like a secondary.
It should come to you as a reward.
Beautiful.
You should be focused on providing services. And I can, I have a sense of this. People, the kind of complex times that we are living into, the society, uh, we think that, society is heading in a very chaotic way. I mean, there is a chaos in the society. That's what we think in our heads. But the reality is, genuine services still get rewarded. So please do not, if you are into these industries like education, health, or defense, or politics, or for that matter, if you're in law enforcement agency, your intention should be to serve, and rest everything will come to you. People are very appreciative by nature. uh, the day you have clean intentions, it will be recognized by people, and you will be rewarded sufficiently for that. You don't have to make money as your primary goal in these industries.
Beautiful. I love that. I love how you have talked about your project, how you talk about the various obstacles that you felt when you were talking about your sister, and what was the scenario that you went through. And then you talked about how you turned the table uh, in your favor or in under your control. And then you gave certain examples from your own life, how you are building this omni-channel approach, how you have built HealthCAA, how you're going forward with that vision. And then when you are talking about the outcome and the output, like what is happening and what will happen in the near future, what next, and how you are trying to build that network for the people so that becomes accessible, it becomes affordable for them. And so this is very very interesting. This is the power of voice. This is the power of a thought. This is the power of an idea. This is power of an identity, a belief, a value. This is what I believe in. This is what I call communication. First, communicate to yourself and then communicate to the world. Offer them that service and then get that, whatever the outcome, as a reward, as an appreciation, as an incentive. So I just want to say, on behalf of
Absolutely.
all the listeners, that thank you so much.
Before you end, I just want to
Sure,
add one more thing.
sure, sure, sure.
Vicky, when you said it, now the power of communication, I completely believe in the power of communication. For
Mhm,
me, the entire project came into existence through an internal voice.
Beautiful.
And there were
Beautiful.
several ways to communicate about it, like obviously the thought process triggered the entire project.
Mm-hmm.
Then I had to obviously make it. I have to bring my idea on table so that
Mm-hmm.
others can understand. So I had to do communication in several ways. So I started making several presentations, then drafting a business plan, then talking about the project to people, uh, either vendors or the team that I'm working with. All these people were needed to be communicated about the idea that came from within. So the power of communication is extremely important.
Mm-hmm.
And I certainly believe that if you are not able to communicate, I mean, I'm not talking about the language, I'm
Mm-hmm.
talking about the communication here. If you're not able to communicate, there will be a lot of ideas that will die untimely.
Beautiful.
So you need to have a powerful communication. You need to put your thoughts across to other people for them
Mm-hmm.
to comprehend it. And also, one thing, because you also mentioned about my sister, I'll tell you, this internal thought is an internal communication for me. It's a very personal thing to me, right?
Mm-hmm.
I just want to tell you, this is my way of keeping my sister alive.
Beautiful.
I really wanted to
I
keep
love
her
that.
alive, and I didn't know what could have been a better way uh, than this. So, obviously, I really want to tell this. I really want to tell people that my sister is alive through this project. She's not
Beautiful.
gone ever. So there is a sincerity. All these things are very internal to me. It's an internal communication that happens within me. And
Wonderful.
then it gets translated into this project. It's a very personal thing, if you see.
Mm.
Now,
Mm.
because your listeners would be focusing about communication. So communication is not just about talking,
Mm.
it's
Mhm.
about so many things. I mean, there are thoughts involved into it, there are ideas involved into it, there are emotions involved into it, then there's an influence involved into it, because when you're talking externally to people, you want them to be relating to your idea. And because if somebody doesn't have a sense of awareness about healthcare, I need to communicate them in a way that they realize the value of this and they become aware why it is important for them. And so it's about sort of giving training to them that why it is important and this should be considered and it should become a part of your life. So communication is the key. I'll tell you, my entire project is the result of the communication, both internally and externally.
Beautiful.
So it is that important. And I don't know if you would have noticed, my voice is very polite in nature. I'm very soft spoken. And this is a reflection of my attitude at the same
Mhm.
time.
Mhm.
So all these things plays an important role. I mean, I don't hesitate to say that this project may be late, at a later stage it become a bit technical, because there are a lot of technical things that has to be developed.
Mhm.
But the essence of this project is the inner voice that I had within
Beautiful.
me.
Beautiful.
So with that, I want to say thank you for the opportunity once again. It was such a pleasure to speak with you about the project, and I want to say thank you, your audience who were, if they're still listening. Thank you for your patience to all the all the listeners. And with that, I would like to put a rest to my thought. Thank you.
But thank you so much, Sandeep. On behalf of the all the listeners, I just want to mention that the way you have articulated your thoughts, the way you have shared your ideas, something that is very close to you, the way you have poured all your emotions in front of us. Thank you so much for that. We are glad that you came, you took your time, and you came here and you shared all these wonderful ideas, beliefs, values, and thoughts, and different emotions. Because I strongly believe that for me, communication is nothing but thinking something, feeling something, believing in it, and doing it. And you are the perfect archetype. You are a perfect example for that. So thank you so much for doing this, and it is always a pleasure having these wonderful conversations with you.
Thank you, Vicky. Stay healthy and keep your healthcare management in plan going, and always keep that in your mind.
I'm gonna give all my details to the HEALTHCAA community, and they will be helping me with that.
Thank you to your listeners as well. I really appreciate your time. Thank you.
Sure. Thank you so much, Sandeep. Have a good day. Take care.
Bye-bye.
Bye-bye.